Autism is a developmental disorder. It starts very early in life. Parents often now first notice symptoms in early childhood, 12 months to 24 months. We've gotten better at predicting the early signs of autism. Early symptoms of autism include things like difficulty pointing, not necessarily responding to their name or to social cues in the environment. It's a disorder that affects social communication, so both the ability to communicate with other people through language or nonverbal ways, like gestures, for example. It also affects socialization, so the typical things that children would do with their parents, like engaging in peekaboo or social smiling.
We know that social skills are a core deficit of autism spectrum disorder, and that across the spectrum, these deficits really persist across all of the children with autism, regardless of their ability level. During preschool and the elementary school years, we really see children with autism not initiating with the other children, really being on those periphery of social interactions.
As children go into the school years, social situations become much more complex, and so it's very important for us to break these social rules down and to teach them in a way that they can understand. Once they move into the school years, social skills become the top priority.
With social skills, we know that children with autism need to be specifically taught how to engage in these social interactions, because these deficits not only persist across time but get worse as children with autism get older.
When I speak to parents and I ask them what matters most to you, when I speak to the parents of the younger children, they often tell me they want their child to communicate. When I talk to parents of almost every child that is in school-age children, almost every parent tells me they want their child to have a friend. Our Emmersiv project is aimed at improving social skills using a Kinect-based video game system. So it's a motion capture system that immerses the child into this world with animated peers. So we have other children who are cartoon characters that they interact with.
We know that children with autism are inherently motivated by interventions that use technology, and those types of interventions also really capitalize on the inherent visual learning strengths of this population.
The skills that we've chosen to work on, effective understanding, sportsmanship, and conversation skills, are sort of the basics of being able to interact with other children. So we're hoping by learning these things in the home environment using our game system that they'll be able to get a basic understanding of these things and be able to use them with other children.
We know that in terms of working with children with autism, motivation is definitely one of the primary barriers that children with autism typically like to play by themselves. They really have a hard time connecting with peers their age in terms of play and communication skills. The idea is that if we can keep the child really motivated and engaged and teach these behaviors in a safe and fun environment for them, then they will be able to acquire these skills. And in our research, we will look at the ability for these skills to generalize to other children in play situations outside of the treatment setting.
So I think the direction that we're going with the older children is more social skills work within the clinic with homework for the parents. And I think the way the field is going is really trying to use technology more and more to allow for practice within home setting.
So the idea with our project is to create this world where they have these animated peers so they can practice and learn the skills in a very safe environment and then be able to apply them outside of that environment in the school setting, for instance.
And so the way I see the West Health intervention fitting in with the interventions that we're really trying to target for the older children is working on those peer relationships, which is one of the core difficulties for the older children, and being able to provide a component that can be done outside of the clinic setting and allow for more continuous practice.
At West Health, we use research to help move an idea from a great idea to a great practice, to really translating a concept that may change the cost profile of healthcare to something that really does go all the way from idea to impact. And so we're about taking ideas that can be implemented quickly and proving that, in fact, when implemented, we do see that we've changed the cost, the quality, the accessibility of healthcare.
For our research study, we are currently recruiting 6 to 12-year-old children who have a diagnosis of autism spectrum disorder. We are looking for the types of children who may be doing okay in school, their communication is intact, but that really lack the social skills to be able to develop friendships and to be able to interact comfortably with other children. So the hope is that this study will be able to show some potential effectiveness for using this kind of system to improve those skills and to look for generalization outside of the treatment setting.